Well, there is now brand new information on our top story. President Obama is about to speak with religious leaders concerning health care reform. And there is word the president will take a new tone and adjust his message. Now, to give you context, I want you to listen to these clips of the president talking about the public option, you know, government-run health care. The first one is from June, then in July, and finally what he said this weekend. Listen.
If you like what you're getting, keep it. Nobody's forcing you to shift. But if you're not, this gives you some new options. And I believe one of these options needs to be a public option.
That's why any plan I sign must include an insurance exchange, a one-stop shopping marketplace where you can compare the benefits, costs, and track records of a variety of plans, including a public option to increase competition and keep insurance companies honest.
This is a legitimate debate to have. All I'm saying is, though, that the public option, whether we have it or we don't have it, is not the entirety of health care reform. This is just one sliver of it, one aspect of it.
Now, despite what appear to be contrasting statements, Press Secretary Robert Gibbs says the message has been, quoting here, boringly consistent. Today on Fox, Bob Beckel, the great defender of all things Democrat, says the administration has lost control of the message, and now it appears the message could be changing again. Jeff Nussbaum is Vice President Biden's former speechwriter during the campaign. He is also the former Deputy Communications Director and speechwriter to former Senate Democrat leader Tom Daschle. Ron Bonjean is the former Communications Director to former House Speaker Dennis Hastert. He also served as Press Secretary to former Senate Majority Leader Trent Lott. Gentlemen, thank you both. Ron, it seems to me
good to be here.
The reports now that the president is shifting his pitch and kind of leaning more toward this moral imperative of making sure that everybody in this country is insured, kind of playing up on emotion now. That's what the crux of this is.
Yeah, his strategy has shifted all over the place. You know, he first tried to get the bill done before the August break. That didn't work. Then his plan was protested by thousands of Americans across the country in town hall meetings. Then Pelosi calls it un-American to do so. Then Obama blames the media for covering the town hall meetings. Then they blame the Republicans, and now all he has left is a prayer. And he's trying to say, hey, it's the right thing to do. Please, guys, please support this plan. Please, members of Congress, vote for this plan. But the real problem is they're in legislative quicksand. They can't figure out the right formula to get this bill through amongst their own party, and that's where the real problem lies.
Yeah, I want to bring up this poll because I want to get your take on this as well, Jeff, because here it is. We talk about the message. It's shifting, it's changing, whatever. Here's the results. In August, this is President Obama's handling of health care. Approval, 41%. July, 41%. Really nothing there, no change. So he's been out campaigning for this. Disapproval, 47%. It's kind of bumped a point. What do you make of that?
Well, I think one of the things that's important to recognize here is that what the president's trying to do is bring the debate back to core principles, because you showed those clips of different things he was saying at different points of time. And I think what would be interesting also to see is a graph alongside which shows how many people are losing health care, what's happening to the cost of health care. So what the president is refocusing on is not who's up and who's down, because all the polls also show that people are sort of tuned out to the details, but they'll be happy when health care is cheaper, more available, and of better quality. So,
well, I don't know, Ron Bonjean. I don't know about tuning out to the details there. I mean, you know, you look at this, even the White House is kind of acknowledging that this anger out of these town halls has moved the needle a little bit. So I think very much this country is tuned in to exactly what's happening in healthcare. And
one of the things I would say...
What's hilarious...
Go ahead, Jeff.
What's hilarious... This is... Okay.
Here, Ron, one thing, and then you can add, Ron. But Ron and I both know from our time on the Hill, the best place to be is standing off to the sidelines while your opponents fight each other. And frankly, Democrats have been arguing amongst themselves about this one piece of the plan. But unfortunately for Ron and for Republicans, is that they've actually managed to unite Democrats by ceding the debate to some of the fringe elements of the party, some of the people you see in those town halls saying things that are really out of touch with reality. And by letting those people control the debate and letting respectable leaders like Senator Grassley kind of tip their hand and say that they're not willing to work with Democrats. Republicans have
there's been
managed
a
to
lot of
unite
that. There's been a
Democrats.
lot of that. People saying they're out of touch with the reality. I mean, it seems to me like what you're saying is the American people, we hear this again and again, it's misinformation. They're out of touch with reality. They just don't get it, and yet the majority of this country apparently doesn't get it because they don't like it.
Well, here's the reality. 70% of the American people like their health care plan, and Obama wants to change that, and the American people don't like it. Republicans don't like the status quo. They want to have affordable, available health care. But why can't we do something with the current system and help the uninsured? At this point, what this is for Obama is this is politics for Obama. This is not good policy. This is politics. This is trying to save his first year in office from falling flat on his face.
And it's a good point, because I want to put this up, if I can, very quickly, guys, because we're getting low on time. The Rasmussen poll, 54% say that they would rather no health care reform at all than this bill. I mean, 54% would say, look, we're just going to stand pat versus passing this bill. That's bad news.
That's right. But
Jeff, go ahead.
That is bad news.
But 10 years from now, those 54%, if there is
leaders.
Go ahead, Jeff, quickly first.
But, 10 years from now, if those 54% don't see a change in health care, what they're going to see is a health care for a family of four costing $25,000 a year. So really, again, this is one of these things where we're debating the details, we're debating who's up and who's down. But when this happens, and it will happen, people will be better off, and they will be grateful for it, and they will be thankful for it, and they will be happy with their representatives, and they'll be happy with President Obama.
Obama's throwing a Hail Mary pass, turning religious leaders. He's on a wing and a prayer in this one. The Blue Dogs just came out, Blue Dog Democrats, and said they don't support it.
If I might quickly jump in there, Ron, because I want to show this very quickly, because, you talk about President Obama playing on emotion. Well, those who oppose the health care plan are also doing that. This was from the Independent Women's Concerning the Public Option. Listen to this.
Like 2.5 million American women, I survived breast cancer. My mother died of cancer, but today I'm a survivor, and I'm worried about what Washington might do now.
Both sides playing on emotions. Go ahead, Jeff. I'll give you 10 seconds.
Again, the emotions are important, but what's most important is that people have health care that's more available, more affordable, better quality, and it won't change anything for people who have it except make it more affordable.
Ron, final word?
Republicans agree, but this won't work. The American people are on our side. 70% love their health care. 47% don't like Obama's plan.
We'll have much more on this. Ron Bonjean, Jeff Nussbaum. Gentlemen, thank you.
Thank you.
Thank you.
Well, the H1N1 vaccine trials are getting underway on children today. We're going to tell you how many kids are getting the shots and how the government is keeping a close eye on the trials. And when you want to show off a newly buffed bikini bod, what do? You go on national TV, right? Well, you do if you're Britney Spears. Looking good. We're going to roll the tape for you just 3 minutes away.
See what you can do. What would it take for you to just leave with me? Not trying to sound with you, me and you were meant to be.
Caution. Have you or a loved one taken the prescription drug Reglan to treat stomach problems, acid indigestion, or heartburn? Caution. The use of Reglan may be linked to serious side effects: tardive dyskinesia, involuntary arm movements, facial grimacing, or protrusion of the tongue. If you took the prescription drug Reglan and suffered any of these symptoms, you could have a claim to compensation. Call today. Call 1-800-CAUTION. 1-800-CAUTION.
Say hello to the can-doers, the budget masters, the knockout artists who are finding more ways to spread their dollar further, to bolder color in less time. Say hello to newer ideas and lowered prices, enabling more people to